Hi, everyone. Thank you all for watching this recording of the M-LEEaD seminar. I know I apologize that it wasn't, we had technical difficulties and we couldn't get the recording live. So again, I apologize that you'll miss the Q&A portion of the presentation. But again, I'll mention it again at the end, but feel free to ask me or email me any questions you may have about anything presented today. But yeah, with that out of the way, let me introduce myself. So my name's Andrew Hoover. I am a senior in the school public health undergraduate program, and then a first year in the environmental health science MS program at the school public health. And I've been working with Sung Kyun for about 2 years now, doing a lot of work with PFAS. And then I sort of started up with my master's thesis conducted under him, which is what I'm going to be talking about today, which is titled The Associations Between PFAS Perceptions and Consumer Behaviors Across Michigan. Just to start off with some structure to the seminar, I'm going to first begin with the background and aims of my project, then get into the methods and results, and finalize with some conclusions from this project. To provide a baseline introduction, I want to just address what PFAS are. So per and polyfluoroalkyl substances, that's what PFAS stands for. They are also called the forever chemicals. These are a family of chemicals. So some of the main ones which you might have heard of are PFOA, PFOS, PFNA. The structure for PFOA is on the right here. And essentially what you can see is it's this long chain carbon with fluorines attached to it. And that structure has helped it become widely used in industry because it's very hydrophobic and it can repel water, grease, and other liquids, allowing it to help things become stain-proof, waterproof, grease-proof, things like that. But at the same time, since they are so sort of structurally sound molecules, they don't degrade easily in the environment. And along with that, they stay in the body over time. And as a result of that, they are in an estimated about 97% of Americans' blood. Now I just sort of want to note that there are 9,000 types of these PFAS being used, at least in 2021, and that is a huge number. I named a few on the past slide, but there are a lot more than that. And now, just to put it into current context, in 2024, I actually checked this a couple weeks ago, there are 15,000 types of these chemicals being used. So this staggering increase has really been due to, one, the usefulness of these chemicals, but two, their increase, the government has increased banning activity and trying to really crack down on stopping these chemicals. So the responses from the companies that are using them are to make different kinds of them. And that's as a result, you see a lot more being used and a lot more of these different types being available. Now, I just want to talk a little bit about the health effects from PFAS. So some of the main ones are these ones that have this sort of solid line, but essentially it's kidney cancer, liver damage, testicular cancer, increased cholesterol levels, thyroid disease. And there are also many other ones that have been studied more and more as PFAS have sort of becoming more and more prevalent. And some of those are increased miscarriage risk, early puberty onset, early menopause, and more. So essentially, these chemicals have been associated with tons of different health effects. And then I also want to know that I'll talk about this later in the presentation, but there are psychosocial effects to these chemicals as well, where just people knowing that they exist and maybe not being able to have control over their exposure to them, that can also be a sort of stressor in someone's life. All right, now I want to break down this diagram that I made with Sung Kyun last summer, but it's about the PFAS cycle in the environment, where it all starts in the top left at PFAS producing and using industries. Because these chemicals are man-made, they aren't naturally occurring, so they all have to start sort of in this industry process. And the main exposures, I'm going to see if I can get this laser pointer, which I got working in the other one. Okay, perfect. I can see it. So they start off, one of the main routes is through PFAS containing firefighting foam, which essentially this foam can be used at commonly military bases, airports, firefighting practice facilities. And what happens is in this foam, the PFAS can seep into the ground and then sort of get embedded within surface water and groundwater, which this can then be directly drank by humans to be exposed, but it can also be uptaken by plants. And then if those plants then are turned into food products and we eat those food products, we can become exposed to the PFAS there as well. And then fish in these contaminated waters. If we consume that, we can be exposed to. Another pathway is through industrial waste. So these industries can either directly dump PFAS into water that can be used as drinking water and for plants and things like that, or it can be turned into a landfill and then created into a biosolid, which biosolids can be used again by crops, and then it can get into us through food products from those crops. And then the sort of main thing I want to focus on for this project and presentation is the PFAS treated food materials and consumer products, which are sort of items that humans can use and then sort of handle or use through hand-to-mouth behavior and become exposed to PFAS in those products. All right. Now I just want to touch a little more on what sort of products PFAS are in some of the main ones that I'm thinking about in characterizing for this sort of particular project, which are the ones that people can possibly change their behavior around. So things like cosmetics, personal care products, nonstick cookware, and water-resistant clothing. These are all things that consumers can more readily, maybe if they know that PFAS are in the product, they might be able to substitute this product and use another one, for example. But PFAS is also in many other different types of products as well, like paint, stain-resistant furniture, fast food packages, pesticides, and more. Getting a little more relevant towards this project, I was interested in looking at PFAS perceptions, which overall, it seems not many people know about these chemicals. And I will note that there has been a growing concern, though, on media over the past years. And then when people do hear about PFAS, they are fairly concerned just hearing that these chemicals are everywhere and they're harming you. And then I also want to note that companies can coerce communities. Notoriously for this is DuPont into not seeking PFAS information. So essentially, the companies will try to focus on the pluses that their industry may bring, including jobs or donating to local facilities or organizations, and then try to shift the perspective in a positive way rather than focusing on the negative effects of the chemicals they're producing or using. And then I really do want to highlight that there's been a little insight on how perceptions actually influence behaviors. So there's been a lot known about, what people might think of PFAS, but not how those thoughts actually then influence behaviors. And with that, most of the work surrounding PFAS so far is focused on perceptions in environmental justice communities, which could be biased because these communities are more understanding of pollution that's occurring around them. And with that, they could be more cognizant of possible chemicals, including PFAS. So that takes me to the aims of this project for my thesis, which is to administer a pilot survey to Michigan residents and describe the associations between demographic factors and PFAS perceptions, and then PFAS perceptions and related consumer choices. And going into this, we had the hypothesis that a finer understanding of PFAS fosters an increased risk perception of the chemicals. And with that increased risk perception, that increases the likelihood that one would engage in consumer behaviors that would reduce exposure to PFAS. All right, getting into the methods. So the first thing I want to highlight is the study population, which was sort of split into two categories. So the first category was university students, in which to get this part of the population, I contacted 15 public universities in Michigan. That's all of the public universities in Michigan, and asked them if they would survey their students about these chemicals. And ultimately, 5 did say that they would survey both their graduate and undergraduate students. However, actually, wait, let me see if this will work. So these are the 5 that offered to survey their students. So it's the University of Michigan, Ann Arbor and Dearborn, Michigan State University, Michigan Tech, which for anyone who's not from Michigan, that's in the Upper Peninsula, and then Wayne State University right outside of Detroit. However, 2 of these universities, only after surveying their students, received enough responses to analyze, and that was University of Michigan, Ann Arbor, and MSU. So that's one aspect of the study population. The other is Facebook users. When to get at this sort of aspect of the population, I joined Facebook groups for the 5 cities that contained the universities that I had just mentioned. So essentially, each of these areas or regions or cities had a like resident Facebook page, which could be used for disseminating community information, things like that. And that's what I tried to join. And some I was able to publicly join, others I needed approval. And then all 5 of those Facebook groups participated, but then Dearborn and Detroit had to be combined for analyses. And that led to the cities of Ann Arbor, East Lansing, Lansing area, Houghton and Keweenaw County. So that's for where Michigan Tech was. However, there was nothing for a specific city that they were in, just because the populations up in the UP are so small. So they sort of used the surrounding county instead. And then Detroit and the metro area surrounding it. So now getting into the survey dissemination, there were primarily 3 aspects I used to disseminate this survey. So the first one, which is used for U of M, where an email was directly sent by me. MSU, there was an email sent by staff on my behalf to participants or students who may participate. And then in Facebook groups, I did posts where I just essentially put a message in Facebook feeds. And this whole process of survey dissemination occurred this past October 2023, and it lasted for 2 weeks, where I sent a first post 1 week, and then I followed up a week later. And that was what I did for the universities. For Facebooks, I posted 3 times a week, solely due to the fact that in Facebook feeds, if other people posted, my post to partake in the survey could be very quickly sent further and further down the feed and out of view from possible participants. This is actually what the sort of sample messages looked like for this project. So the left is the Facebook one and the right is the university email. But essentially you can see that there's, the invitation to participate in the survey. I tried to minimize the amount of information about the survey solely because I was trying to gauge what people knew about these chemicals. So I didn't want to provide a lot of context about the chemicals so that people might search it up and know more about it going into the survey. And then I also provided the link to the survey, and then probably one of the more important aspects to a lot of people, the chance to win a $25 gift card. All right, getting into the actual survey, there were 29 total questions on the survey. Essentially, 11 of them were about these PFAS perceptions, 10 were about PFAS-related consumer behaviors, 8 were about demographic information. And the survey was conducted online through Qualtrics. And after all these questions, it took about a median completion time of 5 minutes. And again, as I sort of had mentioned on the previous slide, the compensation for this, there was a raffle for 60 $25 electronic gift cards. So now this is something, if you were in person, I actually had surveys to hand out to people to look at, but you'll just have to look at the slide for now, but it's the same thing. And the first 2 questions of the PFAS perceptions section of the survey were used to determine if people knew what PFAS were. And essentially the first question I asked was this one about, have you heard of PFAS? And then the second question was, do you know what they are? So essentially I used both of these questions to determine if someone knew what it was, these chemicals were, and then I changed the following wording for the questions in this section of the survey based on this. So if someone indicated they knew what PFAS were, they would be asked, do you believe, ... the rest of the question. And then if they didn't indicate knowing what they were, they would be asked, do you think, before the rest of the question. Now getting into the second part of the perception sort of portion of this survey, it was primarily 3 sets of questions about PFAS, their health outcomes, the environmental media they're in, and then the consumer products they're in. And it followed the format of the first question being a Likert scale, and then the second question being a select all to apply. And essentially what I did is, like this example on the bottom left, I asked, do you believe PFAS are harmful? And then if they said anything other than definitely not, they were asked the following question of which of the following problems may be caused by PFAS. So then I repeated a similar process for the environmental medium that these chemicals are in, and then the consumer products that they're in. So the last thing I want to note about this section is I then compared all of those responses that I sort of just talked about and graded them based on the EPA's PFAS information. I tried to avoid making the questions graded on anything so granular that only really academia or scholars would know of. So I tried to make it something that if anyone had searched or really sought to look a little more about these chemicals, they would understand the effects, or they'd be able to answer all of the questions. And then after grading these, I created a PFAS knowledge score that was essentially the number of correct answers. So it was ranked 0 to 13, where a higher score was equivalent to higher knowledge about PFAS chemicals. And then I also asked 2 other questions. So one about reliability, which I'll get into later in the presentation. And then I asked another question for those who didn't know of PFAS. I asked sort of where you got the information that led you to answer your responses throughout this portion of the survey. For the primary outcomes, these were the 3 main things that I was interested in looking at. So the first question is, how often do you consider PFAS being in products when choosing one to buy? And the options were never, rarely, sometimes, often, or always. However, never and rarely and often or always were combined. And then the next question was, if a product said PFAS free on its label, would you be more likely to buy it? With the answers of no, unsure, and yes. And then the final thing was, suppose a product with a PFAS-free label costs $5. What's the highest price you would pay for a similar product with a PFAS-free label? And the options were $5 to $6, $6 to $7.50, $7.50 to $10, more than 10, or none, and you wouldn't pay more for this product. And then I also asked another question that essentially mimics this question, but with a $50 product. So trying to get at possible differences in what people are willing to pay for more expensive versus cheaper products. In the last section of the survey, the demographic information, I asked 8 questions. Again, it was age, gender, race, ethnicity, education, and household income, which were both really, they were asked in both study populations, but they were only incorporated and used in analyses for Facebook groups due to high variability in the university respondents. And then location, that was the locations that I sort of popped up on the screen previously, either the university or that Facebook group. Then there was the residential zip code and email, and these weren't really used in analyses at all. These were essentially to confirm people were Michigan residents, which you had to be to qualify to get one of the gift cards. All right, this I think was one of the more important aspects of the survey, because when I went into this, I really didn't know much about creating surveys, and that's where I had a lot of support from both Sung Kyum, but also at the Institute for Social Research, Dr. James Wagner, who heads the Survey Research Center there. And essentially what we did is we sort of optimized this step one, which was really making sure that the questions were concise. None of the questions being asked were sort of out of place or not going to be used in the future. So really we could minimize the time people were spending on the survey while giving us all the necessary information in their responses. Then there were these two tools, readable.com and Quaid. I hope I'm saying that right. But essentially, these are both validated survey tools that help simplify wording, make question wording more comprehensible and readable, but then also ensure that you don't need any sort of previous context around a topic to be able to understand what the question's asking. And then the last section was pilot testing, which was done through both lab members of mine and then my family members as well. And this was essentially to ensure that there were no logistical errors when they were actually trying to access the online version of the survey, where they could go through the skip logic that I'd mentioned in the PFAS perceptions section. That all worked properly, and that, you know, there were no spelling errors and everything was easy to do once actually looking online on the software. So that was all the stuff for the survey. So then after that, for this project and for this presentation, I really focused my analyses around three aspects. So the first two are descriptive ones, which are knowledge score distributions for different demographics, and then also the distribution of consumer behaviors. And then the more model aspect of it was doing logistic regression models for consumer knowledge and knowledge score with consumer behaviors. So the covariates were knowing what PFAS are, age, gender, race, ethnicity, location, and then education in the Facebook models. And then I want to know before getting into the results that the smaller groups were collapsed in some of the models into an other category so that they weren't inherently excluded from the models. All right, getting into the results. So first off, this was so many more responses than I was expecting. I really went into this. I remember talking to Sung Kyun and I was like, I really hope to just get about 100 responses and I would feel so happy. And this blew me out of the water. 4,208 people initially submitted the survey, and then 4,165 were 18 and up and consented to participate. Then after excluding those with more than 10 missing responses and those who didn't pass the reliability screening, which I'll touch on the next slide, we had 3,994 respondents. And then for these analyses, we only considered complete cases, which got us down to a final size of 3,648 respondents. And that meant for a total of 560 being excluded from the analyses, which was 13% of the population. Now, I sort of just touched on the reliability, but now I want to go into a little more of what we did there. So we asked a series of about two questions, and then we did a couple of other things as well. But the first thing is we asked people again, as I mentioned earlier, do you believe PFAS are harmful? And then we asked, do you believe PFAS are healthy later, with the assumption that someone's beliefs would be opposite for both of these things. So if someone said they're probably not harmful, then they would say they're probably healthy, or vice versa. So what we actually did is we excluded anyone who said for the harmful, definitely not, and definitely, but then also said the exact same answer for healthy. So someone who indicated PFAS are definitely not harmful, but PFAS are definitely not healthy, they would be excluded. And then we also removed those who were unsure if they'd heard of PFAS, but they happened to know what they were. All right, getting into the sort of distribution of knowledge across different demographics, I'm just going to preface that I'm going to try to go through these next few slides pretty quickly. It's just a lot of box plots. And yeah, I'm going to try to really just focus on touching on the key factors from all of them. So this is knowledge score by study population, where you can see the demographics on the y-axis, which will be the same throughout all the future box plots. Knowledge score is on the bottom on the x-axis. And then there are the sample sizes for the groups above the boxes, along with the median knowledge score for them. So you can see here that there's pretty substantial differences in the knowledge distributions for university and Facebook groups, where universities had much higher. And actually, because of this, we decided to consider the groups separately for analyses. When looking at knowing what PFAS are, you can again see a pretty staggering difference. So the people who said yes tended to know more in terms of their knowledge about the chemicals. So those were the people who were answering the I believe questions about PFAS, where the people who didn't know what PFAS were, they were sort of guessing and answering like, do you think about these chemicals? So you can see a difference in knowledge there. With age, you can see in the universities on the right that as age group increased, so did the knowledge score, the median. And then in the Facebook groups, you can see that in the highest and lowest age groups, those had the highest knowledge score medians compared to the middle categories. For gender, there were overall no substantial differences between the groups. I just wanted to note here that other included transgender individuals as well as non-binary. And you can see some pretty big differences where in the universities, they knew more than the other two categories. And in the Facebook groups, it was less. And then overall, women tended to have higher knowledge scores than men. When looking at race, you can see that white and European individuals had higher knowledge scores in both groups. And that had some pretty strong, I feel like, implications for me that I'll talk about in the concluding sections of the presentation. When looking at location, you can see that Ann Arbor has higher in both populations. And again, Ann Arbor is a notoriously affluent community compared to the others. So I think there are some implications here as well. And then the last sort of box plot is about Facebook groups and education, where you can again see a sort of disparity here, where as education level increases, so does the knowledge score. All right, getting into the consumer behaviors, the first outcome was the frequency one considered PFAS being in products when shopping. So you can see here that in universities, a lot of people said never or rarely for considering PFAS when shopping. And then sometimes, often, and always are much less, and they're increasingly lower. Whereas in the Facebook groups, the sometimes category is actually the most frequent, then often and always, then the lowest frequency of responses were in never or rarely. So you can see a pretty big distribution difference in who's considering PFAS when they're shopping. And then this was the next outcome, which is when would be more likely to buy a product labeled PFAS free by study population. And you can see here that an overwhelming amount of people in the Facebook group said yes, they would be more likely. And then in the universities, while yes was the most common answer, unsure was very close. So again, differences there between the two populations. Now, this is the for buying a product that costed $5, how much would you pay for a similar one that had a PFAS-free label? And you can see that for the Facebook group, most people were willing to pay between that $6 to $7.50. And then as the price increases from there, the amount of people in those groups goes down. And a similar trend was in the universities, where a lot of people were wanting to, or were willing to pay that second higher price range, but not much more than that. And then I want to contrast this with the $50 item, where you can see actually a similar distribution in Facebook groups, but universities, that second higher price group goes down substantially, where that first one goes up a lot. So essentially, as price increases, people are less willing to want to pay more for a product that is labeled PFAS free. All right, getting into the models, which are quite complex, and it took a lot of my R knowledge to make them, but also to figure out how to interpret them. So this is the odds ratios for knowing what PFAS are and knowledge score, with the outcome of frequency one considers PFAS being in products when shopping. So just to familiarize you with this plot, so the outcome, you can see that never, rarely is the frequency. That's the referent category, and that's the green. And then often or always is the blue. And then sometimes is the red. And then on the left, you have the exposure variables, which are knowing what PFAS are in the top and knowledge score in the bottom. And then in the plot, the university responses are on the right. The Facebook groups are on the left. And then the model is down below. And the points are the regression estimates from the multinomial logistic regression models. And then the sort of intervals around them are the 95% confidence intervals. So what you can see is from the bottom left in the blue, a 1-point increase in knowledge score is associated with a 23% increased odds of considering PFAS often or always when shopping compared to never or rarely, and that's for Facebook respondents. It was associated with a 7% increased odds for university respondents, which you can see in the bottom right in the blue. From the top left in the blue, compared to those who don't know what PFAS are, those who do know have a 49% increased odds of considering PFAS often or always when shopping compared to never or rarely. And again, that's for Facebook respondents, and it was associated with a 2.87 times higher odds for university respondents, as shown in the top right. And then when looking at this as a whole, you can essentially see that there is pretty significant findings that the frequency one considers PFAS when shopping increased with increased PFAS knowledge. And then when looking at the next outcome, so it's again the same structure. And from this, you can see, so the only thing really different here is the model at the bottom, but then the outcome on the right. So yes, for buying a product with a PFAS-free label, that's the blue. Green is no for buying that product, which is the referent category, and that's in green. And then unsure is red. So you can see from this, in the bottom left in the blue, a 1-point increase in knowledge score is associated with the 27% increased odds of buying a product, of buying a product labeled PFAS free compared to not buying the product for Facebook respondents. And it is associated with a 32% increased odds for university respondents, which is shown in the bottom right. From the top left in blue, compared to those who don't know what PFAS are, those who do know have a 2.85 times higher odds of buying a product labeled PFAS free compared to not buying the product. And that's for Facebook respondents. And it was associated with a 65% increased odds for university respondents, which is shown in the top right. So sort of, again, breaking all that down, you can again see significant findings where people who had higher PFAS knowledge were more likely to buy a product that had a PFAS-free label. All right, so after all those results, I just want to walk through some of my main takeaways from this presentation and this project. So again, the main findings. So overall, more people than I expected knew about PFAS and had more knowledge about it. So 1,619 respondents, that's 44% of the population, knew what PFAS were. And then the mean knowledge score was 7.2. And again, just thinking about the 0 to 13 range, halfway would be 6.5. So it was above that halfway mark. However, with this knowledge, there were disparities present. Socially advantaged groups had the highest knowledge scores. So when I'm thinking about this, I'm thinking about Ann Arbor, white and European individuals, and then those who are either currently in university when comparing the university to Facebook respondents, but also even those in the Facebook respondents who had higher levels of education. So essentially increased education was associated with increased knowledge. And then knowing what PFAS were and PFAS knowledge score were both significantly associated with increased consideration of PFAS when shopping and willingness to buy a product labeled PFAS free. So now getting into the strengths and limitations of this study. Overall, I mean, one huge strength is the number of responses collected across multiple communities in Michigan. This provided novel insight into how PFAS perceptions influence consumer behaviors. This survey was also created. There wasn't much to reference for it, but now this survey can then be used and implemented within other environmental health contexts. And it was aided by its reliability measures it incorporated. However, there are some limitations. One big one is recruitment bias, where those emails I sent out, said PFAS or environmental chemical in the title. So respondents more passionate about chemicals may be more likely to click on it and engage in the survey to begin with. And then also it required one, either being in a university, or two, having Facebook and consistently using it, which are both indicators for those who have reliable phone access, internet access, and those who may have higher SES. Along with that, the survey was disseminated in multiple ways, which made it hard to accurately measure the response rates. And then we also excluded 3 universities and then 350 respondents, and had to merge some covariates, all due to small sample sizes. So those people weren't included in the analyses. And then there were also some possible confounders that weren't measured, with the main one being rural and urban, just due to the differences between not only access to educational materials in rural and urban communities, but then possible contamination by PFAS in those communities. So now I want to get into, I know I'm a little over time here, but just some of the future directions. And I have one more slide after this. But essentially, I'm hoping that one of the big things to do is further research. And I'm hoping that in a future PhD, I'll be able to explore how consumer behavior actually influences PFAS exposure, and if these changes in behavior actually do result in differences in PFAS exposure over time. And then sort of depending on that, there are a few different ways that should be that we can proceed. And the first is, if consumer behavior isn't shown to really change exposure, then exposure is probably primarily occurring in things like through water or ingestion. And that way, government advocacy would really have to be pushed for family level PFAS regulation to mitigate that exposure. And then if consumer behavior does show to really influence PFAS exposure, then really working to educate and inform vulnerable populations about PFAS, with the hope that they could possibly take action to mitigate their own exposure. But above all else, I think I learned through this project that consumer products need to have increased regulation, and we really have to shift away from chemicals being innocent until proven guilty. And we've really faced the consequences of that by just the sheer number of PFAS that are now, number of PFAS, types of PFAS that are in our communities. Finally, some wrapped up thoughts. Consumer behaviors are an important possible exposure to chemicals that need to be further investigated. Perception surveys offer a unique approach to environmental health. They require a lot of work, but they allow communities to voice their own opinions. And then the results can be directly applied back towards communities. And then overall, if you take one thing away from this seminar, just know that the fight between corporations and government over PFAS use isn't going anywhere. So other interventions like education may be useful for helping people mitigate their exposure in the meantime. All right, so I want to thank my thesis committee, my mentors, and then the MPEG lab members for their contributions to this project. And thank you, M-LEEaD, for having me for this seminar. So thank you. And I know you can't ask any questions, but feel free to email me at this email with any sort of follow-up thoughts or comments and or questions you may have. All right. So thank you.